Okay.
Hey guys.
Hey everyone.
So I'm Dr. Alaina Gair.
And I'm Dr. Samina Mitha.
And this is the third in our kind of mini-series talking about thyroid health. I know we're kind of just outside of Thyroid Awareness Month, but we're just trying to wrap it up. And today we're going to be talking about thyroid treatments. So what naturopathic doctors do when one of our patients has a thyroid condition.
Yeah.
So just a fun fact, they're actually estimating that 1 in 10 Canadians have a thyroid disease, and that 50% of the people who have these conditions actually go undiagnosed. So this is kind of the point of Thyroid Awareness Month, where we're trying to bring awareness to thyroid testing, what thyroid health is, and then how naturopathic medicine fits into helping people heal from thyroid disease.
Yeah, exactly.
Yeah. So to kind of jump in, we're going to run through our top 5 treatment areas, and then at the end we're going to do a little bit on Synthroid versus natural desiccated thyroid and when we use which, and kind of what the differences are. So to get started, why don't you get us started with adrenal support?
Perfect. So we know that, and we've talked about this in the past, but maybe I'll just run through it quickly again, is we know that cortisol, our stress hormone, is one of the most important factors we need to look at with thyroid health, right? If we're treating the thyroid, we're always treating adrenals, right? And so the adrenals sit on top of our kidneys. They're a gland that release cortisol, and cortisol is our main stress hormone. In the morning, cortisol is supposed to rise really high, and then as lunch happens, it's like still rising, but then after that, it's kind of slowly dwindling off until the end of the night where cortisol is super low, so that melatonin can rise and we can go to bed. So what we really want to make sure is that this curve is a nice like bell curve kind of. And so we want to make sure that we're supporting the adrenal glands by releasing cortisol at the appropriate times. A lot of times what we see, especially with thyroid health, is cortisol is too high in the morning or cortisol is too low in the afternoon, right? And so we want to make sure that that curve is really balanced. And one of the main herbs that really helps to balance cortisol is ashwagandha. And ashwagandha is an Ayurvedic herb.
Maybe tell people its other name too.
Oh yeah, it's called withania as well.
Yeah. They're the same thing. Yeah. I've had patients not be aware of that actually. Okay. So good to know that there's
2 names. Yeah. So we have a common name and a scientific name. And so typically as in our practice we call it ashwagandha, but it's also called withania. And withania or ashwagandha is really great. If cortisol is too high, it'll bring it down, and if cortisol is too low, it'll bring it up. So it'll actually help to modulate that response. But what's really great about ashwagandha is that it actually helps with that conversion from T4 to T3, which is our active thyroid hormone. So that's why we really, really like ashwagandha in supporting thyroid health. And I'll actually talk a little bit about some of the other herbs that we think of. Another one that's really great is called blue flag, and blue flag is there because it actually is an alterative, so it's a lymphatic, so it actually helps to like drain the system, and so it really helps to support the thyroid if the thyroid gland is enlarged. The other one is nettle. So we know nettle is really great for the liver, so it actually helps with hormone functioning then if it's helping the liver metabolize any of those excess estrogens that might be around. And then glucol, which is one of the herbs that we commonly recommend in some of our formulas because it actually enhances the conversion again from T4 to T3. So ashwagandha and this herb glucol is actually a really great combination. And then it also helps to increase T3 just in the body. So it's a really, really great herb. The other one is kelp that I really like, only because kelp has a good source of iodine, and we know iodine is required for that conversion. So really trying to make sure we can get as much iodine in as we can. And then the last one is triphalia, and triphalia is actually an antioxidant, and we know that it helps with the digestive system, and in hypothyroidism there is symptoms of constipation, so triphalia is a really, really great herb in this case. So yeah, those are some of the herbs on top of the adrenal support that we usually typically recommend with patients with especially hypothyroidism. This is what we're talking about in general, not hyper.
Yeah. So actually that's a good segue into what I realized we should have started with, which is that although we're talking about thyroid treatments today, these are things that we really individualize when we see someone in practice. So we're talking about the different options today. This is not meaning that we're recommending this for any of you that are kind of tuning in.
Yeah.
It's really important to make sure you talk to either your medical doctor or your naturopath about what supplements are best for you and how to pick and choose. And that's always done based on lab testing. So we don't just blindly recommend these supplements, especially not the herbal ones, because they can actually make things worse if you're taking something that isn't the right fit for you.
Yeah.
Especially when we're looking at something like iodine. So, actually, let me grab my basket of fun here. So, some of the vitamins and minerals are kind of the second thing that we're going to talk through. So, and actually, is this the, yeah, so the Romagna was another one that we would also use, which is another herbal, to help support. I specifically use this when someone presents with Hashimoto's because it helps to re-establish a more of a balance in the immune system, and reduce those antibody levels a little bit.
Yeah, and that Romagna is really good for, as she said, Hashimoto's, which is an autoimmune condition, right? So the body is making antibodies to the thyroid when it shouldn't be making antibodies.
Yeah, exactly. So again, like this product would be relevant for one case and absolutely not appropriate for another.
Yeah.
So one that I would say that, I'll bring a little bit closer, this is the B complex I use most often. I would say in practice this is the one we kind of go to. We're using that to help provide, most of these are to help provide conversion from T4 to T3, as well as actual just general T4 and T3 production. So the B complex is one of those that helps provide those kind of steps that have to happen in between. So that's what that conversion means, translating the T4 into T3, which is the active thyroid hormone.
Yeah.
So another one that's actually been studied to be associated with goiter or just an enlarged thyroid, and was shown to be deficient, was actually magnesium. So this is the magnesium I tend towards, the cytomatrix, and that again helps with the conversion of T4 to T3, but also helps prevent that deficiency that's associated with the enlargement of the gland.
Okay.
What do we have next here?
This one.
Yes, selenium.
Favorite.
Yeah, Samina's favorite. Part of the reason I think that we both really like this one is that the dose means that it's one a day. And when you're taking all these supplements to try and get your thyroid under control, having something that's that simple is awesome.
Yeah, and it's actually the form too.
Yes.
Just tell everybody about the form.
So the form for this one is the selenomethionine. And so why don't you talk a little bit about why we like that form?
Well, that's the actual form that's absorbed in the body.
Yeah.
Like it's well absorbed in the body.
Yeah.
So that's why we just want to give products that are good, well absorbed, and so that you're actually getting the benefit from them.
So you can find like selenium maybe at the health or at the grocery store, but if it's not the selenomethionine, you may not actually be absorbing it, and then you're not actually going to get the benefit of that, of the kind of thyroid protection and the thyroid conversion for the selenium.
Exactly.
So the next one I use only after testing is the iodine. So this is an iodide solution that we bring in after I've done what's called an iodine plus test, where we're assessing your iodine over a 24-hour period in the urine, and then we're dosing the iodine over a short period of time and based entirely on those results.
Right.
So we start very, very low. We do like 1 drop twice a day with this. It's a small, very small dose. And we do it for a short period of time because that's usually enough to get the iodine levels back up to where the thyroid has enough of this ingredient to make T3 and T4. Right. And if you weren't with us last week and haven't seen the video from last week, T3 and T4 is essentially just the number of iodine molecules that make up the hormone. So if you don't have enough iodine, then you can't make those hormones.
Yep.
So just replacing people who often tend to be deficient. Yeah. So the next one, which I actually adore the restorative formulations line for thyroid support and actually adrenal support as well. Yeah. But Thyroid Care is what I would recommend for someone who is kind of having a sluggish thyroid presentation. So this one has slightly lower doses than its colleague, the Thyroid PX. So this helps us it's a good combination of vitamins, minerals, and herbal. So that way we're getting a nice combination product to help support thyroid function. But again, really important to understand that these products aren't for everybody. And especially like when you're looking at Thyroid Care versus Thyroid PX, knowing which one is best for your case is really important. Yeah. And that's where, again, testing comes into place and your subjective symptoms as well.
Yeah. Perfect. What's the next thing?
So the next thing we're going to chat about is moving.
Yeah.
Go for it.
So, you know, exercise, we all know exercise is important, but what should we do and how much should we do? You know what? At the end of the day with the thyroid, all we really need to do is some good quality walking, and that's it. Because we don't want to tax the adrenal glands. We just want to make sure the thyroid and everything else is working properly. So getting those steps in is really key. And it can actually help relieve some of the symptoms related to a low functioning thyroid gland, like depression, fatigue, things like that. So not necessarily there for, you know, exact working on the thyroid, just overall health, right? Is good.
Totally. And I think that's a really good point about not overtaxing the adrenals. So many people, when they come in to see us, one of their complaints is usually stubborn weight. And so when we're seeing that, people tend to try and compensate by exercise, and they tend to be really overdoing it, where they're heading to the gym and really participating in really aggressive, like high intensity cardiovascular exercise classes, or they're going to spin classes. And then they wind up feeling actually more depleted, especially in the few hours following, where what you should see after your exercise, if it's the right fit for you, is a bit of a surge in energy, and then not bottoming out. So we are looking at kind of what's the ideal type of exercise for you. Generally with any of my thyroid or adrenal patients, I don't know what you do, but I recommend 4 to 8 weeks of like low intensity cardio and either yoga and or weight training. And then we kind of reassess and determine if high intensity cardio is okay to kind of resume.
Yeah, and it's very gradual. It's not like, oh, hey, go do an hour of cardio on the treadmill or something, right?
Exactly. Pacing is important for sure.
Perfect.
Yeah.
So that's number 3. So we're talking about moving.
Yeah. So far we've done the supplements, we've done adrenal support and exercise. So why don't you tell us a little bit about the food that we can use? Because that's a question I get a lot in practice anyways. Why can't I get these ingredients that you're giving me in supplements from my food? And the answer is you can.
So one of the most important things that we talked about was selenium, right? One of my favorite supplements, and I'm sure Dr. Alaina's as well. So selenium actually comes from Brazil nuts, is one of the highest source in our food that contains selenium. So using that Brazil nut, just a few handful of Brazil nuts a day.
I think it's something like 2 or 3 Brazil nuts a day. It's really small.
Yeah. And so if we look at that and do that every day, that can actually be really helpful. Making sure you're getting a good quality Brazil nut is also important. So just checking that out. And then like we're looking at all the cofactors again. Zinc. So where can we get zinc? Pumpkin seeds are a really good source of zinc. B vitamins, like we get that from some of our grains. And what else?
I often do vitamin C if it's looking like an autoimmune case, just to help balance the immune system.
And iodine. So iodine comes from seaweed and kelp, things like that. So those are really good sources. And then obviously iron, right? So protein sources of iron include not only animal, but also plant-based sources like lentils and beans and things like that.
Yeah, with iron too, I would say, I mean, it's great that you can get iron in your food, but if you're already deficient, you probably need a supplement, at least for, I would say probably at least 6 months, depending on how well your body's absorbing it and how well your levels are bouncing back. That's one of the ones that I'm a little bit wary of letting people do through food if they're already deficient.
Okay, so we've talked about the adrenals, we've talked about supplements, minerals, moving, food, and the very last one, which is the most important one.
I think mindfulness is probably right up there, partially because when we see a thyroid problem, we often see a stress problem. And so similar to talking about the stress response and how it impacts thyroid hormone production, it's also really important to understand that it doesn't have to be all supplements in managing the adrenal function and kind of reestablishing a healthy balance there. And so mindfulness is one of the most sustainable basic things we can introduce. But what I often see in practice is that people don't know what that really means, and it stresses them out because they don't know how to do it, and they think they should just be able to meditate. And so what I always recommend, and this is my favorite app, It's an app called Bootify, and I'm not getting any kickbacks for this. I just really love the app. My husband is actually the one who introduced me to it.
Okay.
But I like it because it was designed for busy people. So it really goes, the way that it's designed is to help you show you that you can fit this in your day. It doesn't have to be like a half an hour session where you sit down and like clear your mind. You can do mindfulness while you're online and while you're going for a walk and when you're waking up in the morning and when you're falling asleep at night.
Right.
And so it actually has a little pinwheel of activities that you choose from kind of where you're at in your day. And then it has a selection of different mindfulness guided meditations that help you kind of start developing this as a skill.
Yeah.
Because if you're feeling stressed, and even more so if you're adding anxiety into your picture, having someone tell you to meditate can be one of the most frustrating recommendations. And so learning how to meditate and learning how to kind of quiet the mind is something that needs to be taught and learned and worked on as a skill that develops over time. And so this app, in my opinion, is the best one I've come across. I know a lot of people have heard of Headspace, which is also great. I just like that this one's based on like what you're doing in the day. Yeah.
Another good one is called Insight Timer. So that one's really good because you can just use the timer and they'll give you some sounds and you just go for it and you do it. They have some guided meditations in there too. So there's tons. So it's really about, and that's the thing, right? Like, it's really about finding which one works for you.
Totally.
Because everybody's different. Yes. And everybody's voice is different when you go and do a guided meditation.
I learned that I hate women's voices in guided meditations. I don't know why. But I really prefer like a man's voice for whatever reason. One of the ones I found for sleep is called Deep Sleep, and it's by Andrew Johnson, and it's this like lovely, deep Scottish accent man. And it's my favorite. I started using it in 4th year at school and started telling all my patients about it and all of my friends, and then they started telling their patients about it. It's really nice.
That's good. So so there's lots of options. And again, like Alaina said at the beginning, this is just an information session. Please contact like anybody that's your healthcare practitioner, naturopathic doctor, to get specific advice, because at the end of the day, everybody's body's different, and that's how we treat. We use individualized approach to treating, and so that's really important.
Yeah, definitely. Yeah. So before we sign off, we'll do a quick little chat about Thyroid and desiccated thyroid.
Oh, yeah.
So I'll just, I guess, so Thyroid, in case you didn't know, is only T4.
So this is a medication.
Yeah, that's the one that essentially is kind of the gold standard across the medical field. And it is a really well-designed product that is, like, the dosing is extremely precise because it's synthetic. And some people do really well on Thyroid, and then we kind of just put our supplements in place to support that function, because as long as you're converting that T4 into the T3, you're going to be good to go. But some people find that Thyroid just doesn't quite work for them, where their doctor has to keep increasing their dose, and they almost head into a hyper state before they start feeling any change at all.
Right.
And so for these people, trying something like natural desiccated thyroid might be a good option. So why don't you tell us a little bit about the difference between...
Okay.
Yeah.
So natural desiccated thyroid, it actually is not synthetic at all. It comes from a pork source. So we're looking at, just porcine. Yeah. And so it's really, that's the whole point of it. We're trying to get it as similar to our body as we can get it.
Yeah.
Right? And so that's the source of the desiccated thyroid. And it also... So Thyroid is T4, right? We know that that's the hormone that we get from Thyroid, but with desiccated thyroid, we actually get a little bit of T3 and a little bit of T4. So it's kind of nice because it gives you that option of getting some of that activated thyroid hormone already there.
Yeah.
Yeah, that's kind of the difference.
Yeah. And so what we do find is that this is, if you haven't watched the testing video that we did last week, definitely go and have a look into that, because that really helps us determine whether or not natural desiccated thyroid is for you.
Yeah.
And then we also do a really close monitoring process when we prescribe that. So if we are going to give it to somebody, then I personally, and I think you do the same thing, I am retesting their levels 6 weeks later and titrating their dose until we have them at a really good place where their subjective symptoms are better and their lab results are also reflecting that they're in a safe range. Because what can happen with natural desiccated thyroid is a suppression of the thyroid, and T3 can get to a place where it's too high. So we want to monitor for that.
Yeah, we're always monitoring.
And make sure that things are in a healthy range and that we're not increasing risk for anybody.
Yeah. So someone who's a really good candidate for desiccated thyroid is someone whose TSH is a little bit elevated, even greater than 2.5, I would say. And also if their free T4 and free T3 is low, so low? Yes.
Low, yeah.
And if they have positive antibodies, so that's really important. So that's why we're looking at a full thyroid panel, and we talked about that in the last video, so make sure you check that one out.
Yeah.
And then also, if you're on Synthroid and your symptoms are still there, and it's not really working out for you, that's another opportunity to think about desiccated thyroid.
Yeah, definitely. So it's really just, it's not that one is better or less better than the other. Desiccated thyroid was what was around prior to Synthroid. And so the research for it tends to be kind of old and a little bit antiquated maybe. And the dosing is not quite as precise. And so that can cause some apprehension in some people and their medical doctors as well. But I think it's important to know that not all naturopaths can prescribe this. Dr. Samina and I have achieved our prescribing through the College of Naturopaths of Ontario. I always mess that up. And that we have gotten to a place where we know we've done extended learning in this area to be able to prescribe that medication, and how to identify the right person, like who it's
and
right for.
And how to monitor them.
Correctly, absolutely, yeah.
So if anybody has any questions, we'd be more than happy to answer them. So we'll put our email addresses in the comments below, and then also next week, we're going to talk about one of my favorite topics is polycystic ovarian syndrome, and we'll go through the nitty gritty on that and how naturopathic medicine can help. And then in a few weeks,
it'll be 3 weeks from today.
3 weeks from today, we're going to be talking about ovarian health and ovarian cancer. So Dr. Alaina is going to be leading the talk on that. She's the cancer expert here. If
anyone has questions about either of those topics, so PCOS or ovarian cancer or just ovarian health in general, definitely send them our way. Because we can also get some of those, make sure that we're prepped to be able to answer those throughout our talk. So if you want to send them ahead of time, go for it. Otherwise, if we don't answer something that you want to know in any of these videos, just definitely get in touch with us afterwards, because we're happy to answer as much as we can. Just making sure that everyone knows that what we're doing on here doesn't constitute naturopathic treatment, but that we're just kind of sharing what we do in practice, and that if you're interested in working with one of us or a naturopath in general, these are the kind of things you should expect.
Okay, thank you so much.
Thanks for tuning in, guys.
Take care. Have a good day.
I think we're still alive.
Okay.